Hi, I'm Melissa, and this is my friend Alicia, and today we will be talking about human papillomavirus-related oral cancer.
So we're going to be talking about the threat that HPV cancer has become in our society today. We'll be talking about the manifestations in the oral cavity, the risk factors, early detection, and patient education. The human papillomavirus cancer is, or not the cancer, but the human papillomavirus itself is the most common infection in the United States. And incidences of human papillomavirus cancer have been on the rise over the last 20 years. As oral healthcare specialists, it's our job to educate our patients and to perform oral cancer screenings at every appointment.
So as Alicia stated, HPV oral cancer has risen significantly in the past 20 years. It has become the most common sexually transmitted infection, with about 40 types that are available that spread to the mouth and throat through direct sexual contact. Approximately 10% of men and 3.6% of women have oral HPV, and HPV is the cause of 70% of oral pharyngeal cancers. HPV oropharyngeal cancer affects the soft palate, the base of the tongue, the back of the throat, and the tonsils. Many people are infected with HPV early in their lives, and oropharyngeal cancer may not present until later in their lives. There are many patients that are asymptomatic, but there are also a lot of signs and symptoms that may be present in the patient, and so these can be easily detected with oral cancer screenings. So we need to be educating our patients on the risk of HPV oral-related cancer.
One of the risk factors for getting HPV-related oral cancer is being male. The fastest growing population of people with the oral cancer is white, non-smoking males between the ages of 35 and 55. The risk for males is 4 to 1 over women. Other risk factors include having increased numbers of sexual partners, especially if not using any barriers during oral sex, and for those who have their first sexual experience at younger ages. Other risk factors are for those with weakened immune systems.
So some patients may be asymptomatic, but there are a series of symptoms that may present in the patient. Some of these include a long-lasting sore throat, earaches that last more than a few days, hoarseness, swollen lymph nodes, pain when swallowing, unexplained weight loss, and ulcers or sores intraorally that may last 2 or more weeks. Some of the extraoral symptoms that may be present are painless lumps, that these can occur outside of the neck, swollen but pain-free tonsils, swelling and lumps inside the oral cavity, and pain when chewing.
So for prevention, as oral healthcare professionals, we do need to be doing those oral cancer screenings at every appointment so that we can get some early detection going. When we are doing those, as we all know, when we're doing our extraoral, we need to be looking at the face, the neck, the head, the hairline, the thyroid, the TMJ, and when we're doing our intraoral, we need to be looking at the lips, the tongue, the roof of the mouth, the floor of the mouth, and the back. Especially when we're looking at oral cancer related to HPV, we need to be looking at the back of the throat, the tonsils, and the tonsillar pillars, and we'll be looking for a strawberry-like exophytic lesion, as shown here. We will always be looking for discoloration and lumps, asymmetry, and enlarged lymph nodes.
So as we stated, HPV has risen rapidly in the past 20 years, so our intraoral and extraoral exams are extremely important, as well as performing oral cancer screenings at each appointment with our patients. They're pretty quick and simple to do, and they take virtually no time, so they are very important to perform during each appointment. We should also be educating our patients on the HPV vaccine and making sure they know that they should be receiving this vaccine before they are exposed to human papillomavirus. If we find anything abnormal during our intraoral or extraoral exams, we should be referring our patients so they are receiving the best care that they can get.
Really quickly, to add, there's also a vaccine, a couple of vaccines available. One is called Gardasil, and that's a quadrivalent vaccine, and one is called Cervari, and it's a bivalent vaccine. Those are recommended in a 2-dose series for those 11 to 14 years of age, and in a 3-dose series from 15 to 16 years of age.